We are undoubtedly in virus season. Emergency department visits for flu and RSV are significantly high. While COVID-related visits remain lower, they are steadily rising. Welcome to the AM Update video and podcast. Today we're joined by the AMA's Vice President of Science, Medicine and Public Health, Andrea Garcia, for our weekly headlines overview. I'm Todd Unger, Chief Experience Officer at the AMA. Welcome back, Andrea. Thanks, Todd. It's great to be here. Let's dive right into the top headline making waves, California wildfires. The devastation has been immense and unfortunately health concerns are bound to persist. How exactly do wildfires and their smoke impact health? Great question, Todd. A Washington Post article recently highlighted this issue, explaining that prolonged wildfires worsen air quality and heighten health risks. Wildfire smoke contains fine particulate matter, or PM 2.5, which is about 1/70th the width of a human hair. Due to their small size, these particles can penetrate deep into the lungs, heart, and even the bloodstream. Additionally, smoke from burning household items like plastics, electronics, and aerosols releases harmful chemicals. This toxic mix leads to short and long-term health risks, making wildfire smoke particularly hazardous. That's concerning. When exposed to wildfire smoke, what symptoms should people watch out for? According to the EPA, wildfire smoke can cause coughing, wheezing, difficulty breathing, and asthma. The CDC also notes sinus, throat, and eye irritation. Severe exposure is linked to heart attacks, strokes, lung cancer, and even cognitive issues like dementia or Alzheimer's. Children, seniors, and those with pre-existing conditions are at higher risk, but even healthy individuals are vulnerable. Given the risks, what protective measures should people take? Indoor air can be just as affected as outdoor air, so it's crucial to reduce exposure. Close windows and doors, use air purifiers, and consider HVAC systems with high-quality filters. If driving, set your car's air system to recirculate to avoid pulling in polluted air. Wearing a properly fitted N95 respirator can help, as regular masks don't block fine particles. Finally, monitor local air quality via platforms like AirNow. Gov to stay informed. Let's hope the fires are contained soon. Shifting gears, we're in the thick of virus season and it feels like everyone knows someone who's unwell. What viruses are currently circulating the most? Norovirus remains a major concern, causing sudden gastrointestinal symptoms. Recent data show outbreaks have surged, with test positivity rates nearly doubling over 6 weeks. The GII, 17 strain accounts for 70% of US outbreaks, and is also prevalent in the UK. Norovirus seems to reappear every winter. Is this typical? Absolutely. While outbreaks can happen year-round, they peak between November and April. Each year, norovirus affects 19 to 21 million Americans, leading to hundreds of thousands of ED visits and thousands of hospitalizations, primarily among young children and older adults. Unlike flu or COVID, there's no FDA-approved vaccine for norovirus yet, though progress is being made. That's promising. Are respiratory viruses also increasing? Yes, COVID, flu, and RSV cases are rising across most regions. Emergency visits for flu and RSV remain high, while COVID-related visits and wastewater levels show a steady uptick. Additionally, common cold viruses and strep throat are circulating widely. With overlapping symptoms, it's hard to distinguish these illnesses. What should people do if they feel unwell? Testing can be useful, if knowing the cause influences your next steps. Mild cold symptoms generally require rest and hydration, but testing for flu or COVID can help determine if treatment or isolation is necessary. For more severe or persistent symptoms, especially among high-risk groups, contacting a doctor is vital. What about stomach illnesses like norovirus? Norovirus usually resolves within a few days without testing. However, severe symptoms like dehydration, fever, or abdominal pain warrant medical attention, particularly for high-risk groups like infants and older adults. Thanks for those insights, Andrea. Any final thoughts? Prevention is key. Stay informed, take precautions, and don't hesitate to seek care when needed. Thank you, Andrea, for sharing your expertise. For more updates, visit ama-asin.org/podcasts. Stay safe and take care.